Hello, it's almost 11 a.m. here in South Korea. I'm Oh Young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the country. We've just cut into the Sejong government complex where Son Young-rae, spokesperson for the health ministry, will be briefing us right now on the COVID situation in Korea.
We also have sign language translation available. First of all, here is Mr. Son Young-rae with the responsible regular briefing on the COVID-19 response. Let us now begin our regular briefing for November 6th, Friday. As of today midnight, we have 117 new local infections and 72 cases were reported in the metropolitan area, while 45 cases were reported in non-metropolitan areas. We have one additional fatality. I extend my deepest condolences to the deceased and the members of the bereaved family. Starting from tomorrow, we have the new social distancing scheme. Lately, during the past week, we have looked at the trends of the outbreak, and nationwide, we have about 90 cases, and we also have about 70 cases in the metropolitan area. And Chungcheong province, we have about 14, and in other regions, we have about 1 to 4, means that we do not have any cases that are exceeding the level 1 distancing. And starting from tomorrow, under the new system, we will also imply level 1 social distancing for all of the nations. And also, as for the municipalities with heightened numbers, they have the discretion to adjust the level of social distancing. And as for Chungcheongnam-do province, starting from yesterday 6 p.m., they have raised the level of social distancing to 1.5 for Cheonan and Asan. And we will also look into the restrictions of the number of users and also the eating of the at the eateries. These will be restricted in these elevated social distancing measures, so we ask for your support as well. And however, we will have the social distancing level 1 maintained. However, we are still witnessing cluster infections, and if this increase of the daily cases is continued in the near future, we have the possibility of raising the social distancing level going forward. And if we have increased numbers in the metropolitan area, we also have the possibility of reviewing the elevation of the social distancing measure to level 1.5, and therefore we are also calling for the public's participation as well. Please note that the COVID-19 can spread and is actually spreading at various venues, and they are also spreading not only at eateries and bars as well, but also at other call centers and saunas and so forth. And all of these places are difficult for the quarantine authorities to control and to manage, and therefore we ask the individuals to comply with face mask wearing and keeping social distancing measures, and also avoid going to places that are vulnerable to inspections. And as for most of the cluster infections that broke out lately, we have seen that people did not wear face masks, and also they were all gathered in confined spaces. And for instance, like having meals together, and when you are also doing sports indoors, and also when you are at saunas, please take particular precautions. And also please take particular precautions when you use these facilities going forward. And right now, the medical capacity is in a stable condition right now. The number of patients with severe or critical conditions stand at 50, and we have about 140 hospital beds for the intensive care units that are available for those who are in critical conditions. And we also have expanded the number of these intensive unit rooms to about 145. And out of the 198 hospital beds that are tailored to treat these critically ill patients, we will be increasing the numbers so that we will be able to cure those who have severe and critical conditions going forward. and we believe that this number would jump above the 200. And as for electronic visitor log, we will have some updates. And starting from tomorrow at clubs and entertainment facilities as well as cafes and major 9 facilities, we will be mandating the use of digitalized entry logs. And we also mandate the cafes and restaurants which will be newly classified under these mandatory places, and we have about a 1 month grace period for these venues. And we believe that many would be concerned about the personal information. However, please note that we have encrypted language when we translate this visitor data, so please be insured with your personal data and as well. And if when it's needed, we also utilize the data by joining and combining these personal data, so we believe that these are safe to use right now. So we ask you to also be assured. And for those of you who do not use smartphones, we also have a written log so that people can write their information. And we are also mandating only the people to write their place of their residence, the place of residence, as well as their mobile number. And we also make sure that these will be discarded after a certain period of time so that we can ensure the protection of the personal information as well. And so far, we have seen more than 100 million cases of these digitalized entry logs being used, and also a majority of them have been used for the epidemiological investigation. And when we are investigating the contents using these digital forms, we believe that they are essential because they ensure very fast and very effective investigation. And next, we will also intensify our quarantine measures for golf clubs. And lately, we are seeing an increase of users who are visiting golf clubs. And also, we have seen a large cluster infection stemming from a golf club. And we also have been engaging in a detailed dialogue with these industries as well. And we are also, we will be, and we have been mandating all these guidelines to the golf clubs, and we will be mandating them to apply going forward. And including all of the characteristics of golf, we will be also continuing with the cooperation with the golf clubs. And we will also restrict the people to utilize the driving of the carts, and as well we will also restrict them to have meals or drinks after their golf outings, and also we will also restrict the use of the indoor clubhouses as well. So we ask all of the managers of the golf clubs and also the users and golfers to also comply with these measures going forward. And due to COVID-19, we have seen many houses which are in the low income bracket that have been going through very great difficulties, and we will be providing financial support. And we have revamped this application process, and we are also providing the emergency allowances for them, and we have seen an increase in the number of applicants for this scheme. And as for some local municipalities which have more people who will be subject to these measures, we will also be extending the period of application until November 20th, so that if you are part of, and if you are also under and subject to such scheme, we ask for you to apply as soon as possible, complying with the measures put forth by each of the local governments. And fighting COVID-19 in a prolonged manner, it is also very important that we have all of the individuals of the public to comply with these measures. And it is very effective for us to have the level 1 social distancing, which is maintained right now. And we ask for your support as well. And the government will also make sure that the new revised social distancing measures could be put in place very effectively without any confusion. Thank you very much.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분들께서는 단상.
That was a Health Ministry official Song Yong-rae telling us about the latest COVID-19 situation here in South Korea, which reported 145 new COVID-19 cases as of Friday midnight, bringing the total accumulated number of cases to 27,195. There was unfortunately, however, one additional death from COVID-19, bringing the total death toll to 476. That wraps up our coverage of this morning's briefing. We will be back though shortly at midday Korea time with our regular newscast with Mark Broom. Bye for now.